Welcome to TLevelHealth Explained. This is your go-to channel for understanding the intricacies of working within the health and science sector. Today, we're diving into A1.1, working within this vital field. This video will cover the importance of organizational policies, how they shape ethical and efficient healthcare systems, and their role in ensuring safety and progress. We'll explore how policies act as the invisible structure supporting healthcare, turning abstract principles into real actions. And we'll see how they guide every interaction, decision, and procedure, ensuring fairness, transparency, and accountability. Imagine a world without traffic lights, where everything's chaotic, and accidents are bound to happen. Policies are basically the traffic signals of healthcare, guiding professionals and institutions toward the common goal of safety and progress. Policies take abstract principles and turn them into real actions. They translate ethical considerations into practical guidelines, influencing everything from hiring practices to how they interact with patients. They provide a roadmap for navigating tricky situations, making sure all decisions align with the core values of healthcare: doing good, avoiding harm, respecting autonomy, and being fair. This framework isn't just about following rules. It's about creating a culture of responsibility where everyone understands their part in upholding the highest standards of care. For example, imagine a research lab developing a groundbreaking new treatment. Without clear policies on data integrity, the foundation of their scientific work could be at risk. Or picture a hospital ward where policies on patient confidentiality are relaxed, potentially leading to privacy breaches and a loss of trust. Basically, organizational policies, though often overlooked, are the bedrock of health and science. They're the invisible threads holding together the complex tapestry of care, ensuring every action, every decision is made with integrity, fairness, and a commitment to everyone's well-being.
Equality and diversity policies aren't just trendy terms. They're the ethical building blocks of a fair and just healthcare system. These policies are all about the idea that everyone, no matter their background, deserves equal access to healthcare and opportunities to grow within the field. These policies require a workplace free from discrimination, where everyone is treated with respect and dignity, valued for their unique perspectives and what they bring to the table. They demand that healthcare providers and institutions actively fight against both conscious and unconscious bias, ensuring patient care isn't influenced by prejudice. Imagine a hospital where a doctor's cultural background sways their treatment decisions, or a research facility where gender bias holds back brilliant minds from reaching their full potential. These scenarios, though disheartening, highlight the crucial need for strong equality and diversity policies. These policies go beyond just the treatment room and the lab, covering hiring practices, promotion criteria, and access to training and development opportunities. They require organizations to actively recruit from diverse talent pools, making sure the healthcare workforce reflects the communities it serves. This commitment to diversity leads to a better understanding of patient needs, resulting in more culturally sensitive and effective care. Think of safeguarding policies as a shield, protecting the most vulnerable people in healthcare. These rules exist because healthcare settings naturally have power imbalances. Patients, often in difficult situations, put their trust in healthcare workers, so it's super important to have strong systems to prevent any abuse of that trust. Safeguarding policies include steps to prevent harm, spot red flags, and handle abuse, neglect, or exploitation. These rules require thorough background checks for all staff, clear ways to report concerns, and training to help healthcare workers spot and deal with safeguarding issues. Imagine a young child undergoing a medical procedure, an elderly person with dementia receiving home care, or someone with learning disabilities seeing a doctor. Each of these situations shows why strong safeguarding policies are crucial. These policies don't just protect patients, They also support healthcare workers by giving them clear guidelines and support. Safeguarding policies are essential for building and maintaining trust, which is super important in the patient-provider relationship. These rules make sure healthcare settings are safe spaces where vulnerable people are treated with care and protection, not taken advantage of. Employment contracts are the foundation of the professional relationship between healthcare organizations and their staff. They provide clarity about roles, responsibilities, compensation, and working conditions, creating a sense of security and mutual understanding. A well-written employment contract outlines the scope of practice, working hours, leave entitlements, and disciplinary procedures. It clarifies what's expected regarding professional conduct, confidentiality, and continuing professional development. This clarity is essential for a stable and productive work environment where everyone understands their rights and what's expected of them. Imagine a new nurse starting their first job at a busy hospital. A comprehensive employment contract acts as a guide, outlining their responsibilities, shift patterns, and avenues for support and mentorship. This clarity lets them focus on their main job, providing excellent patient care. Employment contracts also play a key role in defining professional boundaries, outlining acceptable interactions between colleagues and with patients. These boundaries are essential for maintaining a professional and respectful workplace, preventing misunderstandings, and ensuring all interactions are appropriate and ethical. Performance reviews and disciplinary policies, while sometimes seen as negative, are actually important tools for maintaining high standards of care and encouraging professional growth. These policies provide a structured way to give feedback, encourage professional development, and address performance issues fairly and openly. Regular performance reviews allow for open communication between supervisors and staff, fostering a culture of continuous improvement. They provide a chance to identify strengths, address areas for development, and set achievable goals for professional growth. This ongoing feedback loop ensures healthcare professionals have the skills and knowledge to deliver the best possible care. On the other hand, disciplinary policies provide a clear framework for addressing misconduct or performance issues that don't meet expected standards. They outline a fair and transparent process for investigation, disciplinary action, and potential appeals. These policies aren't about punishment, they're about accountability, ensuring everyone on staff adheres to the same high standards of professionalism and ethical conduct. Imagine a situation where a healthcare professional is constantly late for their shifts, impacting patient care and team dynamics. A well-defined disciplinary policy provides a framework for addressing this issue, potentially involving a staged approach of verbal warnings, written warnings, and ultimately, if necessary, dismissal. Basically, performance reviews and disciplinary policies work together to create a culture of accountability and continuous improvement, ensuring healthcare professionals are equipped to deliver safe, effective, and compassionate care. Grievance policies are the safety net of a fair and just workplace. They provide a structured way for employees to raise concerns, report grievances, and seek resolution for perceived unfair treatment or violations of their rights. These policies are essential for fostering a culture of open communication, where employees feel comfortable voicing concerns without fear of retaliation. A strong grievance policy outlines a clear and accessible process for raising concerns, involving designated individuals trained to handle such matters impartially and confidentially. It ensures all grievances are thoroughly investigated and appropriate action is taken to address legitimate concerns. Consider a situation where a healthcare worker feels discriminated against because of their ethnicity or experiences bullying from a colleague. A clear and accessible grievance policy empowers them to report these incidents, knowing their concerns will be taken seriously and addressed appropriately. Effective grievance policies aren't just about resolving individual complaints, they're about identifying systemic issues within an organization. By analyzing the type and frequency of grievances, healthcare organizations can identify underlying problems, such as workplace bullying, harassment, or discriminatory practices. In short, grievance policies aren't just about addressing individual concerns. They're about creating a fairer, more equitable, and ultimately safer healthcare environment for everyone. The world of health and science relies on trust. Patients trust healthcare professionals with their lives, colleagues trust each other to uphold ethical standards, and the public trusts institutions to prioritize safety and well-being above all else. Organizational policies, often seen as just bureaucratic requirements, are actually the threads that weave together this complex web of trust. Each policy, from equality and diversity to safeguarding, from employment contracts to grievance procedures, plays a crucial role in creating a healthcare environment where trust can thrive. They ensure fairness, transparency, and accountability, creating a level playing field where everyone is treated with dignity and respect. These policies aren't static documents, but living, evolving frameworks that adapt to the changing needs of the healthcare landscape. They need regular review and revision to make sure they stay relevant, effective, and reflective of best practices and ethical considerations. Ultimately, the success of any healthcare organization, whether it's a small clinic or a large research facility, depends on its ability to put these policies into practice every day. This requires commitment from leadership to foster a culture where policies aren't just followed, but embraced, where they guide decision-making, shape interactions, and drive the pursuit of excellence in all its forms. In the end, organizational policies aren't just about compliance. They're about cultivating a culture of trust, where everyone from the clinician at the bedside to the researcher in the laboratory understands their role in upholding the highest standards of ethical and effective practice. This shared commitment to ethical conduct, transparency, and continuous improvement is the foundation upon which a truly excellent healthcare system is built.